Illinois shelled out more than $500 million so far in the fight against COVID-19. Target 3 investigator Mark Maxwell teamed up with WGN Investigates to dig through those expenses.
The federal government gave Illinois $3 billion to cover the cost of COVID-19. So how is the state spending that money, and what is a COVID-19 related expense anyways? State spending records show it's not always what you might expect. Things like lab tests or gloves and masks. In many cases, it's much more.
This is a public health crisis, but it is accompanied by massive economic disruption that's unprecedented in modern history.
3 months after Illinois' first known case of COVID-19, the land of Lincoln is now a national leader in bending the curve, reaching key medical benchmarks faster than any other state. But that progress has come with a price tag. The most recent records showing a stack of bills online worth $531 million.
Every penny of what you see on the COVID-19 portal is an allowable expense.
That means the feds will pay it back. But where does all that money go? In the flurry of spending, a WGN investigation found charter flights to China for masks and gloves cost $1.7 million, and 800 iPhones cost $460 grand. But that's not all. Our joint investigation found the state spent $104 million to reimburse the cost of meals for kids at schools and nonprofits. And when the Illinois Emergency Management Agency needed to produce a public service announcement, it gave a contract worth $395,000 to GMMB Inc., a Democratic consulting firm on the Pritzker campaign payroll. The governor's emergency powers allow him to cut through red tape and spend taxpayer funds in a hurry. But with so many checks going out the door, some Republicans want more checks and balances.
We've had virtually no oversight. We've been asking for months for the governor's office to share data, to share the data behind these data-driven decisions that they've been making.
Other big expenses, more than $8 million for medical staff at the Cook County Jail, where 762 inmates tested positive. And hiring enough staff to outfit the McCormick Center's massive makeshift field hospital cost taxpayers $11 million.
5 short days ago, this was an empty convention hall.
But even in Chicago, the surge of COVID-19 patients they prepared for never quite came. Only 38 patients were ever treated there. That site is now closed.
You know, in a situation where you make an incredible investment in a facility, only to have it not be used at all, you have to question, was I basing this off of data that was incorrect? Did I make some kind of assumption that wasn't right?
Whenever you do contingency planning, you prepare for the worst based on the information that you had.
That contingency plan included more than overflow hospital beds, also alternate housing in hotels. The state spent $3.5 million to rent 6 hotels for first responders, healthcare workers, or COVID-19 patients themselves who may need to isolate away from home.
We would have simply been negligent if we did not have a plan to be able to take those folks, get them off the streets, give them a place that they could isolate, quarantine, ensure that they were the COVID positives, they got over that, and then they had the ability to walk out of that facility clean of the virus.
2 hotels in Springfield, owned by the same company, won state contracts worth $1.3 million.
I'm not for any no-bid contracts. I don't like it, never have, never will. But during a pandemic, governing by committee isn't arguably the best response when people's lives are on the line.
3 months later, all 400 rooms remain empty. Not a single person ever checked in.
I would rather err on the side of caution than to have people dying in the streets. It was money we had to spend. We didn't really have a choice.
Mixed in with hotels and hospital beds are some rather unusual expenses. For example, the state dropped a lot of dough on sliced bread at a total cost of nearly $285,000. The Department of Corrections says COVID-19 shut down an in-house bakery, forcing them to buy bread from an outside vendor. So where are those 800 iPhones today? A spokeswoman tells us 26 of them are now in use as healthcare workers use it as a safer way to collect and store your medical records instead of pen and paper during a pandemic. One of them is reported stolen. The rest of those 800 in storage on standby, ready to be deployed and shipped across the state in the event that we encounter a second wave of COVID-19. Reporting in Springfield, Mark Maxwell.